Hello, friends. Hello, friends. Hello, friends. Hello, friends. Hello, friends, and welcome to the Union Labor Advisory Network. I'm Mike Fina. ULA's mission and vision is to support, educate, and promote union labor in our communities. There are great careers that you could have within the building trades as well as public sector unions. We're here to shed light on those opportunities, what they're doing, what these jobs are all about, and highlight them across the ULA's platform. Oh, we're going live now. All right. 5, 4, 3, 2, 1. Hello, everyone, and welcome to the Union Labor Advisory Network, a platform built to support, educate, and uplift the union labor community. I'm your host, Mike Fina, and today we're tackling one of the most important conversations facing our members, our families, and our workplaces: mental health, addiction, and how we create real access to help. Joining us today is Chris Lalevee from Operating Engineers Local 825 in New Jersey, a leader and advocate who's been on the forefront lines of building meaningful supportive systems for union members. So, Chris, again, excited, psyched to have you. I know we've met a few times, and even got a chance to see the training facility last year, which I can't wait to see again. It's really impressive. So, thanks for being here today and sharing some of your time.
No, thanks so much, and thanks for tackling the subject. I really appreciate it.
Yeah, yeah. I mean, again, today's conversation is about more than programs. It's about people. It's about breaking stigma, strengthening our workforce and making sure that no member ever has to struggle alone. So, again, Chris, as a leader in your industry, and again, for people who may not know you, who you are, maybe you can give a little overview of yourself and Operating Engineers Local 825.
Yeah, so Local 825 is based in New Jersey. We cover all of New Jersey and five lower counties in New York, what's called the Hudson Valley. I'm a business agent. My area that I cover is Hudson County, up in the Jersey City area along the Hudson River. Um, and I am also the coordinator of our Members Assistance Program.
Yeah. And I know you've been doing it for some time. We met on some social platforms, LinkedIn, and wound up getting connected. It's like, we got to meet.
Yeah,
Um, so I was excited to meet you and just down to earth guy with family. But what drives your passion for this particular, area of the business, really in supporting your members?
what drives my passion is there's a couple of things. Unfortunately, our industry, being construction, we're the leading career in overdose and overdose deaths. And that's unfortunate reality. We're also the second highest career in suicides, which is an unfortunate reality. That information, when I learned it some years back, had me reflect on some struggles I had in the mid 90s, where I thankfully did get help. But before I did get the help, um, it was more of a mental problem that I was having. I was using substances to self-medicate. There really wasn't anything in place for people like us. When I say that, like the craft workers, as far as psychiatry and things like that, it was kind of, null and void when it came to our benefits. When I think of everything that I went through and I came out on the other side of what was a very long 2.5, 3 year journey, there are people that struggle, and it's tough. I went through it, and I would have really given anything for somebody that would understand, and there wasn't anybody around that would understand. So how do you fix that? You start to be that person. Working with the union, being a business agent, men and women confiding in you of issues that they may be having, feeling a certain way about it, that's very real. This industry is tough on us. It's tough on our families. It's tough on our bodies. There's so many different ways um, that you could veer off into a bad spot. The reality is, though, you don't have to stick in that bad spot. There's help out there. And here we are in 2025. We've gone through COVID, and there's lasting effects of COVID where that upsets people mentally. But even prior to that, addiction is very real, and mental illness and mental health is very real. Our jobs are based on safety. And when you think of being under the influence, or you think of just not being all together in your mind, however big or small that may be. How safe are you on one of our highway jobs or bridge jobs or high-rise jobs? Um, and it's about looking out for each other. It's about just really being humane, taking a little bit of understanding, and having a little compassion for someone that may be going through something.
Yeah. And Chris, for me, we've talked, quite some time, and just looking at what the building and construction trades does for its membership. The evolution of what these map related programs have been, put into place. People like yourself that are really breaking that stigma and kind of putting this front and center, because it's a major issue when we look at healthcare and just the job as a whole. You just having somebody like yourself to be able to open up and have those conversations and kind of move people through the process, and that peer support is critical, and attributes to a lot of the stuff that unionized construction, local, and some of these organizations are doing to make sure that their members are safe and get home, to have a normal career in life. So
Yeah, I mean, the IUOE took a stand, and in 2019 at a general convention, with the help of somebody out of 478 Connecticut, Kyle Zimmer, said, they want to have locals form something like this, have, people there at the ready to help people. It was accepted unanimously. So, here we are, 2005. We have a decent amount of locals doing it. Every year I'm down at our training center in Texas. I'll be down there the end of April teaching peer to peer. So it's a 3-day class that operators can come to and learn it, and I say, boots on the ground people important, business agents important, business managers important, trainers important, you know, um, we all need to understand it. We all need to have some sort of an idea of what may be going on. What might not be a big deal to you may be a big deal to somebody else, and everybody takes things differently. But we're construction workers, so we got to keep our chins up, a little toughened up. We stay hard, nothing bothers us. But deep down inside, we all know that that's not true. We all have seen the quiet guy or girl on the job. We've all seen the person that's kind of distant and something's going on. And instead of being in that crowd asking, "Gee, I wonder what's wrong with him or her," it's easy enough to walk up and say, "Hey, man, you okay? Can I do anything for you?"
yeah,
It doesn't take a lot.
yeah,
So
absolutely.
the more of that we have, the more people that are going to get help. It's sometimes people look at me and they think it's like this spiritual yoga thing, like, oh, he's going to get you to meditate and ask you to do all this stuff. That's not it, man. It's genuinely asking if somebody's okay.
Yeah,
Just genuinely asking. A lot of things that are shared with me, Mike, um, that weigh on people. We have a high rate of divorce in this industry, unfortunately, and that weighs on guys and gals. We work long hours. We're not around to be as present of a parent as some can be. If we're not working, we don't get paid. So in our mind, a lot of times it's better to make the overtime than to make the dance recital or the baseball game. So, in our minds, we're doing the best we can because we're making money to provide. That's what we have to do.
yeah,
And it's very hard to break away to say, well, I'm going to go to that baseball game or I'm going to go to that dance recital. But as years go on, you start to realize the things that you've missed. I grew up with a father as an operating engineer, and you know, I was understanding to it. Well, dad can't be here. He's working this, and that's just what it is. Um, he always asked me how my sports things were and my brothers as well, but at the same time, it didn't have that much of an impact as being there. We do miss a lot of things. I've missed vacations. Um, sometimes there's issues with when you look at kids. Another big thing people speak to me about is, well, my kid's getting bullied in school. I'm going to have to take a day off and go talk to the school. And then there's this and that. And again, it has to do with taking time off of work and not getting paid.
right,
um you know as we get older and parents get older, and whose sibling feels that their job is more important, that you should look after mom or dad, and I don't have the time for it, you have the time. you know it's really life. You don't realize how much it starts to weigh on you. But you can only put 5 gallons in a 5 gallon bucket. So, nobody knows what else you have going on. And something happens at work and that one thing snaps you. It wasn't, it wasn't that one thing. It was everything else underneath it and behind it. But it's about getting help, and it's about how to see things right, how to sort things out, how to try to work through it. And if it gets out of hand into a mental illness, into self-medication, when we look at addiction, very unfortunately, the two leading causes of opioid addiction are surgery and workplace injury. That's our guys, that's our girls. We get hurt. And if we could take something to get to work, to get to that next paycheck, that's what we're going to do.
Right.
Um, but unfortunately, you don't realize you have a problem till it's too late.
Right.
And then there's a problem. But the truth of the matter is there is help. So, to
Yeah.
not be scared of that help and start opening up people's eyes to it.
No, again, Chris, you've been doing phenomenal work. You see it out there in the market. You have that out there. You've been doing great work in New Jersey and across the country with some of your peers and counterparts. But and you even have events. I know you have your events that happen on Sunday as well for people just to call in and have a conversation with you guys. What you do as well.
Yeah, man, we started well, it started out of COVID, with your recovery crowd where they had nowhere to go, and started finding out that some of these guys and gals were meeting in like parking decks when it was raining, it was cold outside, and here we are with this technology. Um, and we started what we called Sober Sundays, and it's been going since COVID, 4.5, 5 years, and it's a great group of people. We have people come in from Ohio to Florida. It's 8 a.m. It's every Sunday morning. We have Christmas meetings, we have New Year's meetings, we have Thanksgiving meetings. We try to hit all the major holidays. One of the guys within the peer program here, Eric Mills, he's been running it. And that whole crew's just been doing a great job, and it's amazing the more and more people that come in, whether you're in a trade or somebody in a trade, it's open to anybody. So it's Sunday morning, and the whole premise behind it was we get up early anyway. So 8 o'clock's an easy ask Eastern time.
Exactly. Exactly. And I know we've mentioned you do so much work. What's the typical role look like for you day to day when it comes down to supporting members around mental health and addiction? Like, is it at the training center at the local? I know you have certain set times or things of that nature.
Yeah, you just in this space, you never know when the phone's going to ring, and you never know when somebody's going to have a problem. But what I did when I developed what I'm doing here is, um, I developed a relationship with our funds and some point people within our funds. And actually, one of the women that came up when I started, and she just volunteered, if I can do anything, I'd love to help. I love everything about what you're doing. And her name is Therese, and she's somebody I can call. She can get into the fund system if somebody's looking for a doctor, if I need something for a recovery center, if I need any information. I try to make it as easy on our member to get into a location to where there's no paperwork to fill out. They walk in, they say, "Hi, I'm Mike Fina. Chris Lalevee sent me," and you don't even have to sign, just get you into detox or get you to where you need to be. And, we'll start figuring out everything later. So, it's invaluable to have that connection between the funds and your union, because with most of us, we're separate entities. One carries the other, and we all have work hours. I've decided to not have work hours. She stepped up and said, "Here I am. You need it, give me a call." And to find people like that, without telling anybody's story, that's the kind of thing where somebody has something within their life that has happened to them, and they say, "You know what? I believe in this. I wish I had this at one time." And when we look at alcohol addiction, when we look at drug addiction, mental illnesses, mental health, things like that, you know, everybody knows somebody. And the more I talk to employers with somebody going to get help, or the more employers have me in to talk about it, I roll it into safety, because it's about safety.
Yep.
You know, when we look at the world today, There's over 35 million people in the United States actively in substance recovery, and there's over 55 million people in the United States actively under mental illness recovery. These people are within our workforce, and then that's not even mentioned within the construction industry, our veterans. All these things really start to play on what's going on. And, some of us can go have a couple of drinks and that's it. Some can't, some get to the point where it's being abused. Um, but, through education and not ignoring it, like I said, we're number one in overdoses. Why would we ignore that?
Absolutely.
But if we've been number one in head injuries, and you're starting to see the new helmets come out with straps. So we're doing something about that. So why wouldn't we do something about the other? So if the statistics are there and everything is there, we need to do something about it. Educating people on the 988 system in place. That's there 24/7, 365 days a week that you can call and you can talk to somebody or you can text it. You know, these are the things I try to bring to companies. Your toolbox talks, you can wrap all this into your toolbox talks instead of talking about your PPE again. I've been one of those guys that's listened to PPE again. The safety talks have to happen. Your insurance companies want to see it. Think of some new material. I got tons of it.
Yep.
I have 12 good safety talks that all fall in to this realm. Then you could do one a month. It's perfect.
Right.
Educating people on your EAP, that's huge. Unions have the EAP, the companies have the EAP. Call them up, find out what they offer. Don't wait for the crisis.
Yeah. And Chris, that was
You know what I mean?
yeah, that was one of the questions I was going to ask you too. MAP versus EAP. What's the traditional? Is there a difference? Actually, how do they work collaboratively?
Yeah.
Or
Yeah. So every EAP is different. Our EAP, I know what they offer. I know what somebody can get. I know different timelines. So I'm just another layer. Truth be told, you get onboarded with a company, you get onboarded with a union, you get a whole bunch of papers to sign, you get all kinds of things, those are things that need to be reminded. This is the EAP, this is what they offer. Um, what I did was I offered a peer level where somebody can call uh, to say it easy, hey, it might not be for me, but what does our EAP offer? I get it. I'm not going to tell anybody. Being confidential in the peer world, I'm a certified peer counselor. Being confidential in the peer world is a number one. It's about getting that person to help, getting that person's family member to help. Nobody else has to know. Um, so, if we could get that help within the EAP, that's awesome. Can I springboard off of that and call somebody in funds? Like I said, maybe it's a child. Hey, my friend Mike, I need, his daughter needs to see a therapist. There's some issues there. Can we get, therapists taking new patients within his area, 10 miles within his house? Can we get that direct, emailed over to him?
right.
And we start working on it right there. And, it's in your email. I'll help call, Therese, who I mentioned, she'll help call. Sometimes it's a group effort. Um, you know, but we don't know what to do when the things happen.
Yeah.
And we panic. So if I can provide that level head and know where to go when everybody's in, the world's gonna fall apart mode, things will work out. But I get it. I get
Yeah.
it. Sometimes I've gotten called 2 o'clock on a Saturday morning, at night, and somebody has said, I've had enough. You have to grab that person right then and there and say, okay, you had enough. Let's get you help. Um, I know the recovery places within our insurance. I know what your copay is going to be. I have somebody there that I can contact 24 hours a day. I can get you a ride there, any time of the day or night. With recovery, there's good and there's bad. I've audited these places. Um, what I've done up until now, and will continue to do. It's a big ask. It's a lot of work, but you know, to have somebody comfortable, they will recover better.
Hmm.
So, your EAP is there on the front line, then you have your long term, you have your recovery. So I do a little bit more than just, get the guy to the hospital so he could detox. I'll get you into a comfortable recovery place to where you're going to get better. And that's what I want. I just want to see people get better, get back to their families, get back to their work life, and do their thing,
Absolutely.
and, and that's it, not throw somebody away or live with the stigma of, well, he's a drunk, he's crazy, she's a drug addict. That might have happened once in their life or twice in their life. But we're past that. We're people.
No, absolutely. And Chris, too, we went through a lot today, and everything that you've been doing. And again, from your experience, what is working, when it comes to helping members, access care and stay on path, with recovery. Is it continuously,
Yeah,
trying
things that are there's a lot that's working. I mean, talking about it works, and it really does work. And overall, I have more people that are reaching out to me, even if they think it's not important, or hey, I hate to bother you with this. At least we can get them an answer. We can get them on a path. Um, the your best advocates that are within your union, within our trades, are people that are on that journey themselves within recovery. These are people, you know, I I laugh with my friends that are in Alcohol Anonymous and Narcotics Anonymous. I said, you guys are the most outspoken anonymous people I've ever met.
to?
Um, but they're great people. And these are people that I keep all at an arm's reach. I have an army of guys and gals I can call, where if I had somebody that wasn't sure if they wanted to go in recovery, these people would wake up in the middle of the night and talk to them, and that's just what it's about. It's about giving back, giving for yourself. And, you put yourself out there, like I did, like others do, people will come on board and they're going to want to be part of it. Like I said, working with the benefit fund is a huge plus, and I guarantee there's people within your benefit funds that want to do it, that will help you without a problem. Um, but on the other side of that, there's improvements we can make as well, and some of those improvements are they're small. Developing something like this is totally worth it. Based on my numbers, and I won't go through my numbers of successes and whatnot, it's totally worth it. There's more people wanting to genuinely get help, whether it's for themselves or for a family member. There's more people speaking about it. There's more people that aren't ashamed to speak about it. I get more calls of, hey, I met so and so on a job and they told me to call you. um you know it's having that phone conversation, even if it's just putting them in touch with the funds. Okay, this isn't anything within my realm, but let me put you in touch with somebody, and it's a soft handoff. um knowing the crisis lines, knowing that people get better when those are the improvements, to speak out for people. Because I think we try to look the other way. We try to not address it, but it's very real. I'm not saying a total, you know, everything has to stop. It's not a total culture shift, but it should be something that is considered when you're doing things within your, union, within your work, you know, areas and stuff like that. A lot of guys like to go out, have a few beers after work. Um, Nobody thinks about the guy that is in recovery that can't do that.
Right. Right.
Maybe once a week we can go out for a cup of coffee after work. It's not that he doesn't want to be with the guys, it's that he can't. A lot of points I make are, meetings and things like that. Offer something that's non-alcoholic, offer some coffee. You know, um, your Christmas parties, offer something different. It's not that, a lot of times, and most of the time, it's not that the people don't want to come, and that they're not grateful for what a company or a union might be doing as far as parties or celebrations. They just don't want to have to be under pressure to have to be in a setting. of something that they're not going to, that they can't partake in,
Right. Right.
so it's a little bit of a culture shift. And the people that I've worked with up until now, it's working.
Yeah.
It really is working. I actually worked with a company one time, and we talked about, I talked to them about the mocktail bar. And the guy called me last year after their Christmas party. He said even people that drink, more people use the mocktail bar than the regular cocktail, because they just brought it down a notch because they didn't want to feel, all foggy the next day. And I said, that's interesting, but he called me really to thank me. And he said, there was a few people that showed up, and there was a few people that actually walked up to him and said, hey, thanks for doing this.
That's great.
Um, so these are people, these are real people. They live in our neighborhoods. They belong to our families. They're in our trades, and you know me well, man. I'm a proud union guy, so I can't call you brother or sister without accepting who you are.
Yeah.
So if that acceptance is the fact that, you know, you can't have a drink, I accept that. I'll have coffee with you.
Yeah.
It is what it is. I'm good, you know. And it's about coexisting together, and it might sound a little corny. In my life, I just think if there was like a little bit more of that, it'd be a better world to live in.
Well, I was going to say again, in a perfect world, as what do you see in the future, from member support, or what would you like to see over the next couple of years? I mean, you talked about a lot of progression and great things that are happening. You know, any expansions on things that you're going to be building on going into this year or the next things that
Yeah,
you.
I mean, I'm doing I'm always doing something, and I'm doing a ton. I'd love to, I'd love to get out more, to some companies, and help them develop, whether it's a company or a union, help them develop something. It seems like a lot, it really does, but many hands make light work, and we learn that on our jobs every day.
Absolutely.
So, these things can be done, and they can be tackled, and they should be taken a little bit more serious than I think they're taking. It's you know, my father used to say when I was younger, well, yeah, we have the military. We might not always need them, but we like to know that they're there, right? So it's kind of like that. And what is your plan when there is a problem? So if we put a plan in place before the problem, and we might not hit it every time, but we start learning from, which is all I did. I learned from it. I learned from it. I got better and better to where I have a pretty good seamless program. You're going to have your stumbling blocks, and that's okay. That's okay with anything.
Right.
But the more I get out, the more I talk to people. I do a lot of work trying to get in the locks in on jobs with my friend Cal. And I know you said that you were going to hopefully we'll jump on here sometime soon, and we'll
Yeah.
talk about naloxone. But that whole subject is a touchy subject. I love educating people on it. Um, I like making people see the other side of it. Too many times in the past, I heard, well, I didn't tell him or her to buy drugs. I didn't tell him or her to stop at the bar. Well, you didn't, but the disease did.
Yeah.
You know, um, when we see somebody, like I said, um, quick story. I was at a wake for a guy that I really appreciated, and he was 58. He passed away.
Mm.
And there was a bunch of us sitting in the parking lot after the wake, and somebody said, geez, 58 and he's gone. And somebody else piped up and said, well, what did you expect? Did you see the way he drank? That day was back in 2016. And on my ride home, I kept thinking, yeah, none of us said anything.
Right.
Not that he would have listened to us, but at least maybe we would have said something.
Right.
So, I take that very personally. That was a friend, a brother union member that I lost. Um, and I didn't say anything either. You accept people for who they are. Not that you want to preach to people, right? But you could say something. And, if it was you and I talking, I would just say to you, Mike, I'm worried about you.
Yeah.
You could come at me and say, don't worry about me. And, come at me all you want. And I'll just say, that's fine. At least me inside, I know I said something.
No, no. We've all seen and had those occurrences happen with friends, family, people in the neighborhood. Just growing up. and
Yeah.
just make sometimes you just blow it off, or that's that's Tommy, that's Johnny, that's how he is. He's crazy. The guy's nuts.
Yeah.
But
Yeah.
making that point to really push the needle a little bit further. Making sure that he truly is okay, because I
And
have lost
listen,
friends to that substance abuse as well. It's just very tough.
people I know 30 years ago, they see what I'm doing now and they're like, you? You
You're the
know,
guy. You're the
so
man.
wow. But that tells you, you might not have liked the Chris you met 30 years ago,
Right.
but we all change, we all move, we all start to, do something different. And I can't tell you really how fulfilling it is when you see that person that was struggling and they're back out there making a living and connecting with their family again. And we get to see this through social media, and it's not even about getting told. You just see it. You're like, that is cool. It's like walking away from the building that you put the steel up on and said, wow, I did that, It's not that you did it, but you had a spot there, and now this person is just doing better,
Chris, I
you
mean,
know, and
100%. I believe that wholeheartedly, because all the work that you're doing and you've made some differences, and you can see the people or the progress that they've had. So you know you made a difference. And we talk about social media and everything that we've done. Again, my career shifted through COVID. My losing my dad, and the mental awareness that I've had even today. We've all changed. Through massive, tragic occurrences, and how do you come out of that? And for me, it's really like you trying to educate people not only about the careers within the skilled unionized construction trades, but also the benefits that are available, the services that are out there, people like yourself that are going above and beyond to make sure that the members are taken care of and have access and have those resources. So I'm proud of what we've accomplished thus far, and just know that doing things more, getting connected with other people of like mind, and showcasing that these programs are there. Unions are taking advantage of it, and there's people like you. The question is like, if somebody, there's locals out there that may not have a strong EAP or MAP program, reaching out to you to understand, how do they get these particular services, could really
sure.
make a difference in their organization.
Yeah, I've called the APs for people.
Yeah,
It's sometimes people don't know what to ask, and I get it. I get it. But the at the end of the day, somebody's paying good money for this service
right.
for us. So it's there, and I applaud the leaders that said, you know what, this is something that we got to do. And the leaders that I gotta say myself, my business manager called me, knew what I was doing, kind of sorta, said, this is what, I want to introduce you to this guy. I want this program put together, done. And that was it. So there wasn't really, he heard the presentation, he understood it, and that was that, put it together, done.
Yeah,
And I feel and I hope that I put together, something really good, and for me to pay it forward to, other trades, other locals. I hear from other trades now, which it's just good that people at least know they have somebody they can call, a friend they can call, whether but within their own, they should develop something. Together, like anything else, we're unstoppable.
absolutely.
We're here to pick each other up.
No, no, absolutely. And again, these platforms, the services you have, just getting that message out there the best possible way. We can make a difference. Together. And as we talk about this too, just accessing support. You mentioned 988. The general number like 911 for these particular services and support that's needed. You know, where can union members, employers, and families go to learn more or connect with these services? They're contacting you. They're contacting their own locals.
So I
What's the best?
welcome I welcome anybody to give me a call. You can put my number and email in the notes. It's out there. I don't keep my number private for anybody. Um, but I do have a great resource list throughout New York, New Jersey metro area of free resources, including 988, which is 988lifeline.org. but I have tons of resources, that are both community based and construction based to help out with this. You know, I'll take a look at your EAP with you. I'll tell you what things mean. I'll tell you what to look for in recovery places. What might be a red flag and what might not be. Places that may be what I'm using. So, if that same place, I can make the introduction to the person that I deal with, and they would love to deal with you too, to get people to where they have to be.
Yeah.
I've done it with a couple of locals, not even in the trades, the IATSE locals here in New Jersey and New York. Just finding that good stuff before, if you're armed like a soldier, if you're armed to go to war, it's not that hard. You have everything that you need. It's harder when there's a crisis and you're trying to make 100 calls.
Yeah. No, absolutely.
So start to build a little bit of a portfolio, and a direction you can send somebody. What's your local VA? What's around for veterans? You'd be very surprised what's around for people. Um, you know, and a way to direct them. And you walk into a place like that, you introduce yourself and you say what you're doing, and they grab you with open arms and go, "Oh my God, here, let me give you this," and you know, they'll give you as much as you want, and it's just cool.
Yeah, because I've been very fortunate to work alongside with the Department of Veteran Services and some of the resources that they have for peer support, the PTSD, and as we talked about the combined having veterans inside the building trades as well. A lot of the statistical data, creates these particular issues that need to be addressed, and where we can help support and guide, the members, to have, successful lives, and just know that the resources are there for them. So again, I just want to thank you for the work you do, for helping lead this critical conversation, for the members that you serve, and for the movement as a whole. You're doing incredible work. And to everybody listening, if today's conversation spoke to you or someone you care about, please know that help is available and that reaching out is a sign of strength, not weakness. You can learn more about accessing support and members assistance programs through your union and through the ULA network as well. I mean, again, together we're building stronger members, stronger unions, and stronger communities. So again, Chris, I just want to thank you for everything. If there's anything that you want to say, to anybody out there as we wrap up our world today.
All right, listen, I appreciate the time that you've given me to get this message out, and I know there's people out there doing it. I appreciate what they're doing. And let's just keep it going. Let's keep it going for everybody.
Yeah.
We all want to see the pensions we're working towards.
Yes, and having stronger, communities, and healthy union members, from operating engineers to across the building trades and all the crafts. Again, just proud to be in this particular space, supporting unions, and it's just great to have you as a friend and advocate in this particular space too. So, thank you for all you do, Chris.
Thanks, Mike. I appreciate you.
You got it, brother. And then follow and like and subscribe to the ULA network, and we're going to get a lot more of these resources out there. And again, Chris, pleasure, great talking to you. And until next time, we'll get some more information out there. All right.
Sounds great, bro.
All right. Thanks, Chris.
Right on.
I'd like to thank all our sponsors for helping to build and promote the ULA network. It is because of you that we're able to support, educate, and promote informative content relevant to labor. Please subscribe, like, and share our channel and media. I'd like to thank you all for your support.